Hello everyone. Today we will talk about our heart. Today we have with us Dr. Sunil Thanvi, who is practicing at Zydus Hospital as a MDTM cardiologist. So today we will know what is the heart and what are the main cause of symptoms heart disease. So we will talk further about that with Dr. Sunil Thanvi. So sir, today I would like to know from you, sir, as a Indian, there is a lot of heart problem is going. So sir, what is healthy heart? I would like to know from you, because from outside the patient is having a health, they are thinking they are healthy, but from inside they might be thinking that is their heart is proper or not working. So would like to know from you, sir.
Yes, I think it's a very important question, Umang, because most of us today, in this era of high stress and westernization of diet and lifestyle, are leading very unhealthy lives. And although we may feel that we are healthy and our heart is okay, but there could be some symptoms or signs that could tell us that probably everything is not fine as far as the heart is concerned. So if you feel that there is some amount of chest pain which is not usual or which is not regular or which was not there earlier, which is coming up recently, if it is causing you to stop your activities and take a rest, if you have breathlessness and exertion, if you are not able to climb stairs, if there is a lot of fatigability, if there is swelling of feet, these are all certain signs and symptoms that could tell us that probably your heart is not as healthy as you think and there could be some problem in it.
Doctor, sometimes it has been seen that the common person having a chest pain. So how it can be differentiate that chest pain is heart attack or not? How one should identify that, sir?
Yes, I think the most common presentation of patients to our emergency rooms or to our OPDs is basically because of chest pain, and it is very important to understand that not all chest pain are heart attack, but every chest pain could be a potential heart attack. It's oxymoron, but we need to understand this very clearly. The reason I'm saying this is because earlier we used to see a lot of elderly patients coming to us with heart diseases, but of late, the last 4 to 5 years, we are seeing a lot of young patients coming to us with heart diseases, heart attacks, angina, ischemia, so on and so forth. So these days, we don't take any chest pain lightly, and we always consider it to be heart attack or a heart problem unless and until proved otherwise. So how do we clearly sort of differentiate whether this chest pain is because of heart or not? First and foremost, if the chest pain character is that of heaviness, compression, tightness, especially in exertion, probably the pain that you're having in your chest is because of your heart. If it is associated with a lot of perspiration, nausea, vomiting, giddiness, blackouts, again, probably you could be dealing with a cardiac chest pain. Third and foremost, of course, if it is associated with breathlessness, inability to carry out routine activities, again, this likely could be a cardiac issue. However, if the chest pain does not radiate, radiation means normally the cardiac chest pain would radiate to your left arm, to your jaws, to your back, to the back of your head. So these are common points of radiation of cardiac chest pain. If this is not there, if your exertion or your exercise capacity is not limited, if you have localized pain which can be sort of pointed with a finger or which when you press, if the pain is there, these are certain things that probably are non-cardiac, and we can safely say that the patient may not be having a heart problem.
Doctor, is there any warning signs or risk factor for this heart disease?
Yeah, so warning signs of heart problems are, of course, the presence of risk factors, as in if you are a smoker, if you have high cholesterol, if you have obesity, if you have diabetes, if you have a family history of early heart diseases, if you consume alcohol, which is way beyond limits, and of course, if you have a high stress life, then probably your chances of having a heart problem are very, very high. On top of that, if there is a trigger, it could either be an infection, it could be stress, it could be anxiety, it could be anything, it could be extra hypertension, probably your chances of heart attack goes up.
So, doctor, how to prevent this heart attack, and what one should do immediately if he gets heart attacks? Give some advice for that.
Yeah, so I think these are two separate questions. First, I think we need to address the fact that if you're having a heart attack as a first aid, what you can do. I think if somebody in your family or society or a close relative or a friend, if is having a chest pain which you feel could be heart attack, first and foremost ask the patient to lie down, arrange for a transport to nearest hospital so that you can take him immediately to a place where there is a physician who can have a look at the patient, do an ECG, run some tests and figure out if the patient is having a cardiac chest pain or not. That is first and foremost. Second, of course, if there is Sorbitol which is lying around in a house, if some elderly is taking, probably putting it below his tongue could help, but that is not the treatment. It is just a sort of a standby therapy until you reach the hospital. And of course, once you reach the hospital, the patient has to be attended immediately. There is a concept of what we call as the golden hour. Treatment taken within this first hour of chest pain will give you complete resolution of heart problems, and in future your heart will not suffer any consequence of the attack that you have had so far. If this time increases, which means that if there is delay in taking treatment of a heart attack, if it is like 2 hours, 3 hours, 4 hours, beyond 6 hours, there is no point in taking any treatment because the damage that is done is almost done. So try to get to a hospital as early as possible if you think that the person could be having an ongoing heart attack. Second part of the question as to how we can prevent it is of course a healthy lifestyle, wherein I normally tell my patients to take healthy diet, daily exercise, try to do some meditation, fun exercises so that they are stress free, and of course to stay away from all sort of substance abuse, whether it is tobacco, alcohol, so on and so forth. So basically by and large, if you lead a happy and healthy lifestyle, you should do good.
So, doctor, finally, would like to know from your side that what one should do for a healthy heart and your tips to stay fit and healthy.
Yeah, so normally what I tell my patients is my 20 minutes theory that you should at least have 20 minutes of physical exercise daily, 20 minutes of relaxation, like maybe listening to soothing music, or whether it is a good book that you like to read, or whether it is gardening or any activity which gives you mental peace and relaxation. And third, of course, is what you call as meditation, yoga, pranayama, so that gives you overall emotional, mental and physical balance. So by and large, if you lead a healthy lifestyle, healthy diet, do daily exercise, take care of your mental, emotional, physical health, you and your heart both will remain healthy for years to come. Thank you.
So, doctor, thank you very much for giving very useful tips for everyone for our heart. It is very much appreciated. Thank you very much.